Unscheduled Care Coordination Hub, UCCH, and Hospital at Home Service. Maggie's story.
Hello, I'm Maggie, and I was treated by Hospital at Home. I was feeling very ill. I'd come back from Tenerife, and a couple of days later I was very ill, and that lasted for about a week. I went down to the hospital, and the hospital examined me and sent me home again and said, "You're fine, just ride it out." During the next week I became very ill, and my daughter rang 111. I was having trouble breathing. They said, go down to A&E or the trauma unit. I couldn't make it down there, so she dialed 999 for an ambulance.
So for processes is that a member of the public will phone 999 or 111, who will then pass across to us. The job will appear on our screen and we'll have a look at it. We'll review the patient's notes and history, and depending on what they've said to the call handler and also what they've been graded as a category, with East of England they'll be coded between C1 and C5, C1 being our high kind of our cardiac arrests, and C5s being our lowest acuity jobs. So we'll review what they've told the call handler, and based on that information we'll potentially say, actually, this is suitable for our community providers to look into, and we'll pass it across to the community teams. Get matrons out, get district nurses, get therapy teams or falls lifting teams out to these patients, which would be much more appropriate than an ambulance, and for us, save ambulances for emergency calls, but still getting help to those who do need it.
We're working with East of England Ambulance Service. Our aim is to try to provide the best level of care for a patient, which may or may not involve hospital admission. So ambulance crews will go into a patient's house either as a result of a 111 or a 999 call. They'll assess the patient and they will use their professional judgment as to whether they think the patient needs conveying to hospital or not. If they think not, then they will call a single point of access contact number into the Unscheduled Care Coordination Hub. So that will come through to either me or one of my colleagues. And then we'll have a professional discussion about the patient's current clinical status, where might be the best area for this patient to receive their care. It's usually relayed to them by the crew on scene, and it would go along the lines of, you have a choice, you can go into hospital if you would like to, but the feeling at the moment is that you don't need emergency care and we can provide care for you in your own home. And that would involve, for instance, a matron coming in, doing another top-to-toe assessment of you, taking some bloods, some urine samples, anything that they think might be clinically appropriate, and we will be in contact with you every day during your stay with us.
Hospital at Home cares for patients with complex and often acute healthcare needs. Under Hospital at Home, patients can receive treatments they would otherwise need to be in hospital to receive, such as IV fluids and medication.
I found the process very good because it meant I didn't have to go to the hospital. It meant I could stay at home in my own bed. It made me feel safe because I was getting visited every other day, blood tests taken, just being well looked after really. A doctor would ring me with the blood test result and explain everything to me. So it was very good, I was very pleased with it.
So Hander at Home is when we go out to a patient in the community and we don't see that they will benefit from going to hospital. So we have a number that we can call that goes straight to the hub, and they get triaged over the phone. So sometimes we talk to like a district nurse, a nurse, palliative care, doctor, and then between us we sort of liaise with each other to try and get the best patient care, and normally that means leaving the patient at home, and within 2 hours or even an hour the other healthcare professional comes to the patient's house and looks after the patient in the community. For us, it means that we've left the patient at home and we know they're getting care within the next 2 hours. It also means that we get freed a bit quicker so we can respond to our next emergency.
If I had to look back on it, I think I'd be very happy to recommend it to anybody.
A handover at home helps the patient no end, and also the patient's family. It just suits everybody.
Hospital at Home is a Hertfordshire Community NHS Trust Service, HCT. UCCH is delivered by HCT in partnership with East of England Ambulance Service, NHS Trust, Essex Partnership University, NHS Foundation Trust, and Central London Community Healthcare NHS Trust.